I'm Bev. I work with a program called APPRISE at Lancaster County Office of Aging. APPRISE is a program that helps people with health insurance questions, people who are Medicare beneficiaries or soon going to be going on to Medicare. The word Medicare strikes fear in the hearts of many people, and I can understand that because it is a very complex system, and it interacts with lots of other systems. As the first speaker said, there are constant changes, and there are going to be continued changes in the next, how many years, with the Affordable Care Act, with changes. Every year something changes. So it's very difficult for people to get a grasp of the whole picture. And what I want to do is just give you some basics. I have some resources for you, and actually one of the resources is something that when you have signed up for Medicare, you will begin receiving this resource in the mail. It is the Medicare and You book, and that comes every year, and it's really an excellent resource. I was at a training about a month ago, and someone from Medicare presented information to us, and he referred to that as the Medicare Bible. And it has every topic in it, I think, that you would think about. And if it doesn't have the topic, it tells you where to go to find additional information. Medicare is something that is based, usually for most people, on taxes that you've paid. And you see that taken off of your paycheck when you get that. There are times to sign up for Medicare. And the first time period that I want to tell you about is called your initial enrollment period. And maybe if you've had family members who have retired, you may be a little bit familiar with that. And what that period is, when you are first going to be eligible for Medicare, you have 3 months before you turn 65, the month of your birthday, and 3 months after. It is to your advantage to sign up the 3 months before, because if you do that, that will guarantee that your Medicare benefits will start the month that you turn 65. If you wait and sign up maybe in a couple of the months after you turn 65, your benefit starting time will be delayed. Some people do get Medicare automatically. And the two ways that we see that most often are if you've been on Social Security disability for 2 years and then 24 months, you become automatically eligible for Medicare. And that is regardless of your age. That's if you have someone who's under 50 or under 65, we'll just say under 65, receiving Medicare, that tells you that person has been on disability for that 2-year period. And that was one of the things that actually surprised me the most when I came to this position about 3 years ago, because when I thought Medicare, I thought 65, that they were linked. And I had people come in who were 25, who were on disability for 2 years and then went on to Medicare. Another way that you can get Medicare automatically, not needing to take an active role in signing up for it, is if you take your Social Security benefits before you turn 65. So if you decide you're going to retire at 62 and you're going to start drawing Social Security, then you can get your card automatically. Let's see, there are a few other cases where you can get it automatically, and one of those is based on if you have a certain physical condition. It's ALS, or Lou Gehrig's disease. When you become eligible for that, then you're automatically eligible for Medicare. For the majority of people, though, you have to take an active role in signing up for Medicare. And you can do that a variety of ways. You can call Social Security and actually make an appointment to go to the local Social Security office, which is out in the Greenfield complex here. They will walk you through it, tell you what your benefit's going to be. I had not realized this till I was looking over the information, but you can also send Social Security a letter that has certain information in it, such as your name, your Social Security number, a signed statement that you want to begin Medicare at a certain date. Or you can do it online, which is wonderful. I mean, it's so much easier for you. You can get to that resource either by going to medicare.gov, or you can also go to Social Security's website, which is ssa.gov. And on both of those sites, you can apply for Medicare benefits. Okay? I do have, and that will be one of the things we hand out, a list of websites that may be helpful for you. So that is how you sign up for Medicare. What you've heard, probably most of you have heard of the parts of Medicare. Part A, Part B, Part C, Part D. D is one of the easier to remember because it's for drugs, so you can make that connection in your head. Part A, and this is really narrowing it down and making it very concise, because of course it's not just one thing. You know, there's many multitudes of resources under that, and that is all outlined in the Medicare and You books. So that is, like I said, a good resource. Part A of Medicare normally will cover hospitalization, any type of inpatient care. If you break a leg and have to go to a skilled nursing facility for a rehab stay, Part A of Medicare will cover that for you. Part B is usually what covers your doctor visits, some home health services, DME, which is durable medical equipment, which would be things like if you need a walker, if you need a nebulizer for breathing, those types of things. That's under Part B. And then Part C, if you've heard of Advantage plans, Medicare Advantage plans, that's what Part C is. The federal government was trying to give people a less expensive choice for supplementing Medicare, and the Medicare Advantage plans were developed with that in mind. Medicare Advantage plans have been heavily subsidized by the federal government. When they began, they offered many benefits that original Medicare, the old original Medicare, didn't offer at all. Original Medicare has very limited coverage for eye, vision, no kind of like a regular checkup. They don't cover that at all. They cover glasses if you have cataract surgery and your vision changes, but Medicare Advantage plans can cover that. It all depends on the plan. I know that when Medicare Advantage plans first began, they would offer things like gym memberships, and some of them still do, but the numbers are great deal fewer than what it was before, because as the subsidy for the plan decreased, you know, that the federal government was paying them per person, you know, to provide services, then both two things happen. The benefits, the extra benefits that they didn't have to provide decreased, and the premiums and copays went up. So, and Medicare Advantage plans are health plans in the form of things like PPOs, HMOs, PFFSs. They may be things, I belong, well, I'm covered by the county, and we have a PPO. So, you know, you're familiar with some of those things. Medicare Advantage plans can work for some people. For other people, they don't work as well. And I'll talk just a little bit about that later. So A is hospitalization, B doctors, C Medicare Advantage plans, D drugs. Any questions so far? If you have anything, go ahead and stop me. And this is, like the first speaker said, you could spend days on this stuff and you'd walk out feeling like you knew less than what you came in with.
I do have a question about sign up. You said if you take Social Security early,
Mhm.
you will automatically be signed up?
If you start drawing your Social Security at age 62, 63, whatever, you still won't get Medicare till 65, but you won't have to actively sign up for it. It will come to you, like in a package, a welcome to Medicare package. Usually when you're getting it automatically, because of that situation, or you've been on disability and now you're getting it, it comes within that about 3 months before your birthday. But otherwise, you do have to actively sign up for it. But you have a couple different ways to do that. Okay. The parts of Medicare, the costs of Medicare. Medicare has, the different parts have different costs. Part A, there is a deductible, which changes every year. And I'm just going to pass these out. And it shows you what the cost for Part A and for Part B is. And you can just pass them on back. One to one. So you have deductibles for A, which this year it's $1,156 per benefit period. I'm not going to go into a big explanation about that because I think it's very confusing. It shows you what the hospital copays are, what Medicare covers, what you will need to cover, skilled nursing care, and then Part A premiums. And don't get worried about that because most people have worked enough quarters and had enough taxes taken off that you don't have to pay for Part A. Thank goodness, because it's all $451 a month. So that, who would sign up for that if you didn't earn it? I mean, that's very prohibitive. On the other hand, Part B, regardless of how much you paid in, you're still going to pay a premium. And that, for this year, for 2012, it's $99.90. And you do have a small deductible for the Part B. That's $140. And actually, amazingly, that amount decreased from last year. So that was very interesting. And actually, the Part B premium decreased too. So we'll see what happens. That can change every year. When Medicare, providers enter into an agreement with Medicare. They agree that they're going to accept the assignment that Medicare has given to each service that they're going to provide. And basically, Medicare isn't going to pay 100% for anything except some preventive services. They will pay 100%. But if a doctor, that's often too, while you look at your doctor bill, whether you have regular insurance or you're on Medicare, let's say your doctor bill is $100 and you have Medicare. Medicare is going to look at that charge and say, you know, we're not paying $100 for that. We've already agreed, and this has been settled, we pay $50 for that service. Now, if a doctor or a provider accepts assignment, that means they must accept the approved amount that Medicare has said that assigned to that service. There are some states where then the provider can charge for that difference between what Medicare has said they'll pay and what the charge is. In Pennsylvania, they can't do that. If they've agreed to accept Medicare assignment, then when Medicare says this is the amount we will pay, they have to agree to accept that. So let's say we've been charged $100, Medicare says I'll pay $50. Now there's still, $50 is their approved amount, but they're not going to pay $50. They're going to pay 80% of $50. So they're going to pay $40, which means you're left with $10, which isn't too bad if you're talking about those kinds of numbers. But if you go to the hospital and your bill is $100,000, now first of all, Medicare's not going to pay the whole thing or make you pay the whole thing. Even if they winnow it down by whatever, you know, half, they're only going to pay 80%. So let's say they bring it down to $50,000. They're going to pay 80% of that approved amount, $40,000. You're left with $10,000. which, you know, depending how healthy you are, that can add up, well, that can add up whether you're healthy or unhealthy. And that also is why many people don't have just original Medicare. They have some kind of plan in place that supplements Medicare. That is probably the thing that's hardest for people to understand and to know how to proceed in trying to choose what should they do as far as supplementing Medicare. And that is something that a prize can help people with. One of the things we do is use a tool on the Medicare website called a Plan Finder tool. And you can use that too. Anyone can go in and use that tool. But you can enter your medications, you can enter what pharmacy you use, you can pull up plans. Now, right now, Medicare website, the most information you get is about Medicare Advantage plans, because remember, that was the plan that Medicare was subsidizing. They are increasing the amount of information that's on there for Medigap plans. And sometimes people use those terms interchangeably, so you don't really know. You know, when someone comes in and says, I want a supplement plan, until they go a little further and you ask a few more questions, you don't know if it's a Medigap or a Medicare Advantage plan. And they're a world of difference apart. With a Medicare Advantage plan, you still have Medicare, but that Advantage plan is taking over the administration of your benefits. On the positive side, that Advantage plan, as I said a little earlier, can offer you extra benefits that aren't involved with original Medicare. So you might get a gym membership. You might get some type of help with the cost of dental, vision, or hearing. On the possibly negative side is that Advantage plan can charge you different co-pays, different percentages than what original Medicare can. And each plan, and we have close to 40 in our area for 2012, each plan is a little bit different, or it would be the same plan. You know what I mean? Even if you have, Geisinger is one company that sells probably about 10 different Advantage plans. Each one is a little bit different. There's no standardization when you're looking at an Advantage plan, okay? If you're a fairly healthy person and you can even get zero premium Medicare Advantage plans. So if you're fairly healthy and you go to the doctors a couple times a year and you're not paying a monthly premium, you can come out ahead. If, on the other hand, you have a couple hospitalizations and your plan says that you're responsible for 30% of the cost, and you get a couple MRIs or a couple specialized tests, and you must pay, you know, a certain percentage of those, and then you're diabetic, and your insulin and your supplies come through, not the insulin, but the strips and all of that come through Part B, and you have to meet a deductible. The plan says you have to meet a deductible. You can end up paying more out than you would if you went with a traditional Medigap plan. On the other side, if we look at Medigaps, and the book again, I have to say, it really does line it out very succinctly and clearly, as clear as that can be. But a supplement, which is the traditional way of supplementing Medicare, it's a Medigap supplement, that works with original Medicare. Now, depending on the plan that you choose, which to make it even more confusing is A, B, C, D, and it goes on. Depending on the plan you choose, and the one that comes to mind frequently that many people do choose that we see is a Plan C. The Plan C, which is a Medigap, works with original Medicare. And what it will do is it will pick up your Part A deductible, the $1,156. It will pick up the Part B deductible, $140. It will pick up your 20% co-pays that you have, that Medicare only pays 80% of. So basically, if you have a original Medicare and a Medigap, a traditional Medigap, you're basically, and a Plan C traditional Medigap, you're paying your premium, but you're not going to be getting any surprise bills because it's covered. It can cost, depending on your age and depending on the company you buy it from, it can cost between, rates run from $130 to $200 a month. But it's, and there's two factors there that I always tell people. Number one, many of the people that we see in our office are people who could not afford that. They're on a very limited income, rather pay the same amount every month knowing I'm not going to have any surprises, or I'm pretty healthy, I think I'm going to be healthy for the next. I would say I don't know a lot about how that change happens, but from what I have picked up on, it is difficult. So to move around. Now when you look, and again in the book there, it shows you the different Medigap plans, and it tells you what they cover. As you get over to the right side of the chart, Those are the newer plans, and a lot of those were just added on back after June of 2010. Those, to me, look more like a hybrid. Some of them look a lot more like a Medicare Advantage plan, and those are cheaper then. Where the ones, like I'm saying, the C, that many people do get, that's very comprehensive, that's going to be more expensive. And I just think that I don't think you can move easily among those plans. I've had people say, I wanted, my premium's going up. I wanted to get in one that's, not quite as expensive. And I think it's hard. I don't have a lot of hard facts on that, but I just know what people have told us. So.
Are those rates like per family or with your spouse?
You alone. You alone per person.
Per person?
Yes. Yeah.
And it doesn't matter whether you both contributed or one contributor?
No. I mean, and with a couple, sometimes we'll have one person on a Medigap and one person on a Medicare Advantage plan for many different reasons. If you didn't get in a Medigap, or even if you didn't get any secondary coverage right when you were first eligible, and down the road you want to get into something and a Medigap's not going to take you, then you go with a Medicare Advantage plan because it's something, to supplement what Medicare doesn't cover.
If you're taking Social Security, are the premiums deducted from your Social Security payment, or?
No, well, if you mean before 65 or after?
After 65.
After 65, they are deducted from your check before you even get it.
Now, if you don't take Social Security when you're 65, if you're going to wait till you're 70,
You would, that's a good question.
but
I'm
you're
not
going
sure.
to take Medicare.
Right. You would have to pay that yourself, just like if you have someone who is getting, let me think how that works. That's the situation where if you are getting Social Security, if you're not getting Social Security and you want Medicare, you can do that. And then at this point, what Medicare does is bills you quarterly. But there wouldn't be any check for it to come off of. I guess you could probably have it taken out of your checking account, like an automatic withdrawal. But when you are on Social Security and on Medicare, that comes right off of your check.
So I thought you said your mother pays it annually.
That is not I'm sorry. We're talking about two different things.
Okay.
My mom pays her Medigap supplement separate.
Okay.
I'm thinking about the Part B premium. That comes off of your Social Security check.
Oh, okay.
And if you are not drawing Social Security but you want Medicare, then that's when Medicare bills you quarterly and you pay by check or automatic withdrawal. Okay, any other questions about that?
Must the person enroll 3 months before age 65 if they're going to keep working?
That's a good question. And that is usually, the answer to that is usually no. As long as you are working and you have coverage through your employer, there's no reason to sign up for the Part B, because as soon as you do, that monthly premium's coming out. Either you're paying for it, if you're not drawing your Social Security, you're paying for it quarterly. But the minute you stop working, sign up, because you have 8 months after you stop working to sign up for Part B. If you are covered by a spouse, well, your spouse is working and you're covered under that plan. If your spouse retires and he or she still has retiree health coverage, sign up for B. You don't want to delay. That is not, how would you know that unless you were told that by someone?
If you're planning to retire in 3 months and stop working, can you sign up prior to stopping work?
Oh, you mean for Part B? Or A or B. You can sign up. That's your initial enrollment period. You can sign up as far in advance of your working time. That's a good question, though.
Yeah,
you know what I
because-
mean?
because
Not that you're turning 65, but that you're stopping working.
Right, because most plans stop in 30 days.
That's true, yeah.
Our
I'm
plan
not-
covers them until the end of the month in which they retire.
Okay, okay. You want to do it at least a month ahead, but I don't think you could do it much more than that. Like you can when you're turning 65 and going on to it. And then you have to look at what kind of secondary insurance you're getting, because if you choose a Medigap or a traditional Medigap, it could take longer than a month to get you enrolled in that. With a Medicare Advantage plan or a standalone drug plan, you sign up 1 month, it begins the next month. Okay? But if you do have coverage because you or your spouse is working and has coverage, then there's no sense of paying that almost $100 a month for the Part B premium. Just make sure that when one or the other retires, that you sign up, as soon as possible. Because we've had people come in who didn't, and then the penalty for that is pretty steep. That's 10%. You can be charged 10% of the premium for every 12 months that you didn't sign up when you were first eligible to sign up. Medicare and the whole thing is there's so many rules, then they're always changing, and then there's exceptions to all the rules too. So, any other questions along that line? Mm-hmm.
Somewhere I read that 6 months before you turn 65, you get government information. I read that?
I'm surprised if it would be that far in advance.
Is it like 3 months? I
What
thought it said 6, but that was last year I read somewhere.
Okay.
Where you get Medicare information or something like that?
I know Medicare will send you information about 3 months, and you can apply for it about 3 months before.
Okay.
Now, the companies themselves, that are selling the policies, you're going to get piles of information.
No, this came from the government, they said.
Okay.
That isn't true?
Well, I've not heard that, but that could be true, and I just don't know.
Okay.
There's so many facts to all of this that
Yeah.
I know I don't know
Okay.
everything. Sometimes I feel like I don't know anything. Mm-hmm.
Yeah, my wife, she got 6 months before she turned 65.
Was she on disability?
I've been
on on the Social Security?
on the Social Security.
Okay, maybe that's how you would be getting it ahead of time. More than 3 months. I think the book says 3 months, but if you're, getting,
Yeah, I was on Social Security.
okay, then you didn't have to sign up for it.
Social Security.
Okay, yeah. Each situation can be different. So you want to make sure you sign up for Part B, when you should. Part D, which is the prescription drug, that you also can get a penalty if you don't sign up for that, when you're first eligible for it. But that's a much more minimal penalty. Part B is really high, can be high. Mm-hmm.
I thought when Part D was first introduced that you had to make a decision one way or the other or pay a penalty at 65 even if you were still working. Is that true?
That's true. Now, if you are working and you have drug coverage that is considered to be equal or equitable to Medicare's drug coverage, then you're not going to be penalized, even if you're, still working and you're 67. But what I tell people to do is check with your HR department and make sure that Medicare considers your current part or your prescription drug plan as credible and equitable with Medicare's, because otherwise you can have to pay a penalty. It's only like 1% of the premium, though.
It is.
Yeah. Okay, good. Most companies, I would say most companies do offer that, but just because so many things can go wrong, I always tell people to check just to be sure. So, let's see. And we're running out of time too. There are resources over there. I've got oodles of pens that have a prize on them, so please help yourself. They're in a box. Medicare and You 2012 books over there.
I'm sorry. Could you explain real quick what all the range of services that your department offers?
Yes, as far as a prize?
Right.
Okay, sure. And there are brochures there about it. What we do, currently I'm offering a new to Medicare workshop about every other month. The next one coming up is June the 13th. It would be more information than what I've shared tonight. You also have the choice of making an appointment to meet with an apprised counselor one-on-one, where you're sitting down and they're explaining your options for supplementing Medicare, where they would run a plan finder search for you using Medicare's website. Let's see, what else? We help people, I mean, we do a variety of services. People who are having trouble with Medicare, people who are having trouble with their Medicare Advantage plan. There's an appeal process. We can file complaints with Medicare. If you just have questions, about Medicare, feel free to call our agency. On the brochures about Apprise, on the back is our phone number. I think on the pens it has our phone number too. We have counselors who are in the office Monday through Friday. They are volunteers who have gone to state training and local training about this whole issue, and of course ongoing training. They're in our office Monday through Friday from 9 to 1. You can always call, leave a message. I will call you back, or one of the counselors. The other thing is, when you do retire, our volunteers, we have about 12 to 14 volunteers right now. All but I think one of them are retired. And they wanted a volunteer position to do during their retirement time that was challenging. If you want that kind, this is the position for you. I'm always looking for volunteers. It is, if you enjoy learning, it's constant learning. If you're a people person, we interact with a lot of different people. We have volunteers 2 a day, at least 2 a day. So you have a buddy there, you're not by yourself. But if you're interested in it from a volunteering standpoint, feel free to give me a call. We have tons of resources. There are benefits for people in certain income and asset levels, but there's also for people you might think, well, I know I'm over those limits. There are many creative ways to save money with health insurance and with drug prescription coverage. Okay, so feel free to call if you have questions.
Well, I want to thank both Gustavo and Bev. I think you know now why we